A study titled Impact of Steroid and Lidocaine Injection in the Sacroiliac Joint in Axial Spondyloarthritis Patients, a randomized controlled trial, would typically investigate the effectiveness and safety of steroid and lidocaine injections for managing symptoms in patients with axial spondyloarthritis, AXSPA. Here's an outline of what such a study might cover. Background: axial spondyloarthritis, AXSPA, is a type of inflammatory arthritis primarily affecting the sacroiliac joints and spine. Treatments often aim to reduce inflammation, pain, and improve functionality. Steroid injections are a common treatment to reduce inflammation, while lidocaine is used for its local anesthetic properties. Objective: to evaluate the effectiveness and safety of sacroiliac joint injections with steroids and lidocaine in patients with AXSPA. Methods: study design, type, randomized controlled trial. Participants: patients diagnosed with AXSPA according to established criteria. Intervention group received sacroiliac joint injection with a combination of steroid, e.g., triamcinolone acetonide and lidocaine. Control group received placebo injection or lidocaine-only injection. Blinding, double blind, both participants and researchers are unaware of group assignments. Outcomes measured. Primary outcome: pain relief measured by visual analog scale or similar tool at various intervals, e.g., 1 week, 1 month, 3 months. Secondary outcomes: improvement in physical function measured by BASFI or similar index, reduction in inflammation measured by CRP and ESR levels, patient global assessment of disease activity, adverse events. Efficacy: pain relief. Patients in the intervention group reported significant pain relief compared to the control group at all measured intervals. Functionality: improvement in functional ability was significantly greater in the intervention group. Inflammation: reduction in CRP and ESR levels indicated a decrease in systemic inflammation in the intervention group. Safety: adverse events. The incidence of adverse events was comparable between both groups, with no serious adverse events reported. Common adverse events included localized pain at the injection site and transient increase in pain shortly after injection. Conclusion: steroid and lidocaine injections into the sacroiliac joints are effective and safe for reducing pain and improving function in AXSPA patients. These injections can be a valuable addition to the therapeutic options for managing symptoms in this patient population. Discussion: the study supports the use of intra-articular steroid injections as part of a comprehensive treatment plan for AXSPA. It highlights the importance of targeted therapies to manage localized inflammation and pain, potentially improving quality of life for patients. Implications for practice: clinicians may consider incorporating sacroiliac joint injections with steroids and lidocaine for patients with AXSPA who do not respond adequately to conventional therapies. Further studies could explore long-term effects and optimal frequency of injections. References: journal articles and studies related to AXSPA, sacroiliac joint injections, and similar interventions. Guidelines from rheumatology societies on the management of AXSPA. This outline provides a comprehensive overview of how such a study might be structured and the potential findings and implications for clinical practice. The study, Impact of Steroid and Lidocaine Injection in the Sacroiliac Joint in Axial Spondyloarthritis Patients, A randomized controlled trial by Ahmed Elsaman et al., published in 2023, investigated the efficacy of intra-articular injections of lidocaine and triamcinolone in patients with axial spondyloarthritis, axial SPA. Participants were divided into two groups, one receiving the steroid lidocaine mixture and the other receiving a placebo saline injection. The primary outcomes measured were pain using the Visual Analog Scale, or VAS, disease activity, ankylosing spondylitis disease activity score, or ASDAS, functional impairment, Bath ankylosing spondylitis functional index, or BSFI, and MRI-based inflammation scores, SPARS-C. Assessments were conducted at baseline and 3 months post-injection. The study found significant improvements in the steroid lidocaine group compared to the placebo group. Participants receiving the injection experienced greater reductions in pain, improved spine mobility, and better disease activity and inflammation scores. These improvements were particularly noted in younger patients and those with higher baseline disease activity. However, bilateral hip involvement was associated with poorer responses. Overall, the study concluded that sacroiliac joint injections with lidocaine and triamcinolone are a cost-effective and practical treatment for managing pain and inflammation in axial SPA, with benefits lasting up to 3 months post-injection. 11 source, 12 source. Yes, Ahmed Radwan was a co-author in the study titled Impact of Steroid and Lidocaine Injection in the Sacroiliac Joint in Axial Spondyloarthritis Patients, a randomized controlled trial, published in 2023. The study evaluated the effectiveness of ultrasound-guided sacroiliac joint injections with lidocaine and triamcinolone in patients with axial spondyloarthritis. It found significant improvements in pain, spine mobility, and disease activity scores for those receiving the injections compared to a placebo group, 18 source.